Good afternoon. It's Friday, May 29th. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas, and it's for our weekly COVID-19 update for Northeast Texas. I want to start tonight to talk about a letter that we wrote. We did a town hall forum in Spanish last night. Last week, I was truly appreciative of Dr. DeLisi joining me for a town hall forum. It was a lot of fun. It's our first experience doing a live town hall with questions and comments from the community. We really enjoyed it, and we'll be doing one the next week or two, me and him again, of just continuing to update community. Last night we did one for our bilingual community, and we did it in Spanish. And started off last night with a letter that I wrote that I asked for them to read last night in Spanish. And I wanted to start off today's update by reading that letter as well, because it's for the whole community. It was for all of us. Thank you. On behalf of the Board of Managers of Titus County Hospital District and the administration of Titus Regional Medical Center, we express our extreme gratitude for your efforts to mitigate the spread of COVID-19 and flatten the curve. Over the past 12 weeks, our community has worked together to lessen the spread. The last 2 weeks have seen an increase of our cases in our community, and this is the time for us to remain strong. The efforts by you and your companies implementing social distancing, masking, and sanitizing have far exceeded our expectations. Diligence in temperature checks and staying home with symptoms have been instrumental in our success. We are so proud of the industries in Mount Pleasant, Titus County, and Northeast Texas for their role in this success. This week and next week are critical as we need to continue to help our neighbors as the peak approaches. We are excited for our heroes who will be leading the town hall tonight and answering your questions and reviewing the actions for success. Thank you to each of you for your commitment to our community. I'd like to thank Edwin and Rosalia last night. You see their pictures. They're the pretty ones of this organization. You get me on Fridays. But they did a great job last night at answering questions. And I truly appreciate their diligence in getting ready for the town hall last night, and then the passion they had for answering the questions. And we'll definitely do more with Rosalia and Edwin in the future as we work on COVID-19 and then other healthcare matters as we get through this pandemic together and go on to our next crisis or next thing we want to get out there in the medical community. I'd like to talk about a couple things today, and then we'll get into the numbers. One of them is convalescent plasma. You may see that in different things. And I want to read a few things. There's some words on the screen, and please don't try and read them and get into the details. But we have the ability at Titus Regional Medical Center to offer plasma that has the antibodies in it of COVID-19. We have seen over the last few weeks of our very sick patients that when we were able to administer this plasma, we saw a quick and sudden increase in their stability and their ability to recover from this disease. This is part of a plan that we did with the Mayo Clinic. Kathy Griffiths and the physicians of our joint task force worked together to get us part of a program with the Mayo Clinic. It is under the IRB, so it's under a review board that they're working for. But this has been huge for Northeast Texas and for our patients. We administered this several times, and we've seen the benefit of this plasma given to our patients who are positive COVID-19. We've been asked this week by our doctors, as the supply of this type of plasma is going down, not only in Texas but in the United States, what can we do? We're working with Carter Blood Care out of Tyler, and as you can see, they are starting to accept donations for plasma for this area. One of the benefits of the increased cases in Northeast Texas is we're going to have quite a few people in this area who have the antibodies in our system that can help save the lives of other people. You can see right there, there's 3 criteria: positive test for COVID-19, symptom-free for 28 days, and the regular blood donation guidelines, and then a website that you can register. We'll be putting out on Facebook today, and over the next few weeks, we'll do some PSA on convalescent plasma and the ability to donate. But this has been a huge win for our health system and our community, the ability to do this. Now we want to pay it back and donate this plasma from Northeast Texas. It wouldn't be Friday if we didn't talk numbers, and I know numbers scare a lot of you. and I consistently hear that. We were on the radio this morning with Carrie, and some of the members of the community are starting to become null to these numbers, and it's just too many, and it's scary. Like I did this morning, I'll do this afternoon. I encourage you, don't get as concerned. Don't let the numbers depress you. Don't let the numbers concern you. Let the numbers motivate you and us to continue to drive change. The other thing I'm hearing a lot is confusion on the numbers. We publish certain numbers. The judge publishes the different numbers from the county, and then the state's publishing the other numbers. I ask everybody to be patient, and it's not about having the exact number. It's about having the trend. And over the last 3 weeks, the trend has gone up. We've seen an increase in the amount of positive cases in Northeast Texas, regardless if it's 401, 402, or 417. That doesn't matter. The trend matters, and every day we continue to see that increase. As of today, what we'll report on our Facebook as Titus Regional are the tests that we do through our health system, whether it be the ER, the Family Care Center, our physician practices, but we're also working with the city and the county on the mobile testing that's done by the state throughout Mount Pleasant. What we're doing with those positives and those results is we're tracking them and calling them for 2 weeks after they're positives to make sure they have what they need. Are there any symptoms that need to be followed up on? Is there anything we can do differently? As of today, we've tested in this area through Titus and the mobile testing, 2,309 patients. We have 461 positives and 112 pending tests that are still out there. Now, this includes Titus County, Camp County, Hopkins County, Franklin County, Bowie County. Quite a few counties from around Northeast Texas area are included in our numbers. So please take the numbers in the trend and don't let them bother you and get you depressed. Use them to help drive change in this area. PPE. Over the last few weeks, we've seen the increase of patients in the hospital. Last week we hit 20 on our COVID floor in the ICU combined. Today we have 6 this morning. Over the intercom, and I hate that you can't be in the hospital right now to see the great work that our physicians and clinical staff and nurses are doing. But anytime there's a COVID transfer of a patient from anywhere, whether it be from ER to imaging, ER to the 3rd floor, ICU to 3rd floor, we page over the intercom for people to know that we're going to be transferring that patient so we can take the right precautions to protect the patients, our other patients, and our employees. Anytime we hear COVID-19, 3rd floor to ER, that means somebody's being discharged. And it's a big win. And you smile, and the people have bells on their desk, and they ring the bell because it's exciting to know that somebody who was on the 3rd floor with COVID, if they're going to the ER, that means they're being released for the next stage of their recovery. So it's exciting. But with the increase of people in the hospital, our PPE has been stressed. We've done a great job of maintaining PPE and being ready for this surge. But this week, on Wednesday morning, when we got in, we were down to 3 days in gowns. That was critical. And using 500 gallons a day, we were very nervous about our supply going into the weekend and the number of patients. I got on the phone with Austin. I got on the phone with other hospitals and our hospital associations. And within hours, we were blessed that rural hospitals across the state of Texas started sending us their gowns and sending extra gowns that they had in their health system. In the beginning of this pandemic, I sent masks from Titus Regional all around Texas to rural hospitals who needed it. And we knew at some point we would need our help, and brothers helping brothers, neighbors helping neighbors. It came into fruition this week. I also saw one last week after I did my COVID-19 update here. We ran into an issue with some of our equipment. We didn't have enough for the number of patients. Reached out to my friends at UT Health in Pittsburgh and equipment, and the CEO over there went to work, and he found that equipment in their health system. And he made the trip and met us halfway so we could use that equipment in our hospital. Again, neighbors helping neighbors, friends helping friends. And the last one on the PP update is that same day on Wednesday, the state reached out as well, and we were able to get 6,000 gowns delivered on Thursday from the state's supply in Austin. So we were excited about that to give us 20 days supply and until our next shipment gets here next week. So we too appreciate all of our neighbors and friends who are helping us in this situation, and the state and local and county governments who are doing their share. I'm going to end today with an emotional plea, and it's just a plea of prayer. Heroes work here. I'm so proud of our doctors. I'm so proud of our nurses. I'm so proud of our clinical and ancillary staff and what they're doing on a daily basis. COVID-19, my friends over the last few weeks have asked me a lot of questions. They've even challenged me, and they doubt on some of the things. What are we concerned about this? And what about this? And is it as bad as this? And flu does this. Well, I'll tell you this. I've been part of Titus Regional Medical Center for 9 years. I've never seen anything like it. I've never seen how sick somebody can turn in just 24 hours. We have 11 of our own employees today who are positive for COVID-19, and we're doing everything that we can to keep them safe. We have 2 of our employees that are in Tyler on ventilators. It's tough. And to see the people that we know that are close, who are our peers, who are our teammates, now on ventilators struggling for their lives, who are a part of one of these heroes that we describe, it's tough. And I would like to ask our community to pray for these families of our employees who are on ventilators and for all the patients that are still struggling with COVID-19, whether in Northeast Texas or in the hospitals around Texas and the United States. Just say a prayer. Just take a few minutes and ask the good Lord above just to wrap his hands around us and protect us and give us the strength during this time. He's the one who can help us through this. Again, thank you for taking a few minutes and letting me spend it with you to talk about COVID-19 and talk about what I love, Titus Regional Medical Center, Mount Pleasant, and Northeast Texas. Thank you.